Welcome to my project. I titled it A Revolutionary Recovery System. My name is Lily Vargas, and really wanted to focus on the recovery system post-operative in our hospitals and after surgeries. So this is a little agenda as to what we're going to be doing today. We're going to start with an introduction, kind of give a little background onto what our current system is, what that looks like, why I think it's flawed, and why these flaws are a need for change, why it should be altered and changed for the better of the patient. So we're then going to talk about what exactly the change is, why it will benefit patients, and what injuries and surgeries would benefit from these changes. If there's any specifications towards who can benefit from this change of recovery, or how the recovery is seen. We're going to talk about who's going to be involved in this proposed change, why I think that we need them. Then we're going to give a brief overview on a case study and an interview that applies to my project. Then we're just going to conclude everything at the end. So this is our current recovery system. Let me move this for a second. There's basically many levels into how a surgery is gone through. So we have multiple levels, but just to keep this presentation short and to make sure that I can upload this, we're gonna just talk about the three major ones. We have first the preoperative, so we're really just preparing the patient for surgery, giving them an overview on what to expect post-op, also what the surgery entails and why they need it, and just basically bringing them to the hospital and getting them ready, making sure that their body is ready for surgery as well. Operative, there's not much to describe. It's the actual surgery, bringing the patient to the surgery room and putting them on that table. Now, post-operative is where we want to see the change. So post-operative, these are kind of little points that are touched upon after surgery. So one of them is getting to walk within the hospital. We want to make sure that the patients are able to function on the daily, and so one of the goals is to make sure that they're doing those laps on the floors. We want to make sure patients are eating, they're using the restroom. There's going to be a lot of hospital staff involved as their support system, and the staff and the doctor and surgeons, they're going to worry about what is needed for the patient. We're also going to focus on the length of hospitalization. So right now the recovery system focuses on, okay, you're well enough and you're recovered enough to leave and go home and then take care of it. So we're really focusing on how short of a time the patient can leave, which is seen as a benefit for a lot of hospitals, and that's normal. You want to keep your resources that you use and time that you use down, so patients who really don't need to be in the hospital can go home. Then we also want to see patients going back to a normal life, so we don't want to just leave them in the middle of their house and just, okay, fend for yourself. That being said, we also want to do a series of tests and making sure the patient can sleep, that the patient has high functionality, that they have reduced symptoms and reduced pain. Basically, overall, after surgery, the patient heads into the ICU or the CCU. That's the first step. Then we get them into recovery room, which is where these points are really touched upon. Sometimes we even want to focus if the patient can even breathe without the breathing techniques and the helps of oxygen that are given in an operation room. So this is a basic overview on what that looks like right now. So what are the flaws that are within the system? There's no focus on a long-term recovery. So recovery does not end right there in a hospital. Once you leave the hospital door, that's it, you're recovered. No, it is not like that at all. Sometimes it's a very long road to recovery. And recovery basically means, it's better defined by the patient. And so what that means is, instead of a doctor saying you're good to go home or you're good to go to work, you are feeling better, your vitals and results are improving, the patient decides and gets to see, okay, well, am I feeling better? Do I feel like I can go back to work? Am I back to how I used to be, or am I better before this surgery? So another flaw is that after leaving the hospital, patients are kind of left to recover on their own. So I read a study that interviewed and surveyed bunch of patients in Sweden. And these patients basically responded saying that they felt that once they got home, they didn't have the proper resources, support, or anything in that matter to help them feel like they're recovering better. Um, so really, they just felt like they were left alone to just kind of fend for themselves. Another flaw is that there's a lack of a team. So a lot of the times it's just doctors arguing over what they think is best for the patient. There's not really a team of doctors saying, this is what should be done, this is what I think, and they come into a conclusion. It's kind of just information thrown at the patient, whether or not they understand it, and just for the patient to decide, which is obviously a good thing that they decide, but there still needs to be a better guidance and more of a team effort. Um, Another flaw could be that most of the time it's really what the surgeon or the doctor wants rather than what the patient wants. Um, it's kind of belittling to some patients, according to the interview done in Sweden. They felt like they weren't really being heard, or that the system was more focused on what the professionals thought is best rather than how the patient felt. Um, Also, the patients felt as if they didn't really have a clear understanding or education in terms of their recovery or their surgery or how they're feeling and what to expect. And so they felt like once they were being told to go home, they didn't have that information to fall back on and say, am I feeling better? What can I do to feel better? Some of the patients within the survey also said that their emotional well-being decreased because of the lack of emotional support. So when they're in the hospital, they do get to see a lot of hospital staff, nurses, doctors, residents, and what have you, and they all focus on getting this patient better. Like, they want this patient to be able to leave the hospital, and a lot of the staff there care for their patients. So when they're in this hospital, they're forced to go on walks, they're forced to, be on their feet and kind of pressured to feel better, but that is the support that they have. So once they go home, yes, they do have their family and their friends to fall back on for support, but let's say that this patient were to have a long road of recovery. And so after a while, the friends or the family and the support system that they have, they really don't feel like they're there anymore. They're kind of bored with the situation. They're kind of, okay, well, this patient isn't really going to change. And so one patient had quoted that, yes, once he had left post-op, that their family and friends were revolved around him and that they really cared for what was happening. But after a while, it was kind of like no one was there. So really, the mental health of these patients went down. Patients are sometimes also not able to fully recover to their preoperative functions. So this is kind of what I talked about before. What this means is that some of the patients who undergo surgeries feel as if they're not back to how they used to be or better, because that's what you're supposed to get out of a surgery. And this was not really met, nor was it asked to of them. Then we also see longer recovery times because they're not really centered on how they're feeling, how their pain is. These recovery journeys are prolonged, and it's mostly focused on shorter recovery times, which means to get them out of the hospital faster, but that's not where it ends. We also had surgical setbacks like some complications which would cause a more extensive surgery. So one patient said that he woke up with stitches up to his sternum, which was not planned for at all, which was very intimidating, and he wasn't really given that information as to why or what to do from there on. So, if this wasn't really enough to convince you that we do need change, this is kind of a list of why we do need a change. So, one is to better the experience for the patient. We do want to emphasize that patient care is important, and we want them to feel that their recovery is not a terrible experience. It's not going to be the best, but we do want them to feel better. And how we can do this is that we can better our healthcare. So we want to improve our healthcare systems, change is needed once in a while. We don't want to stay at the same level because clearly it's not working for a lot of people. We want patients to have a better recovery so they can feel better sooner and feel as if they're going back to normal. Even with a better recovery, we can take better use of our time, our resources, and expenses for both parties. So we're not just considering the patient here. If patients are starting to feel better and have a less recovery time in general, not only when they're in the hospital, there's reduced chances of patients going back to the hospitals for complications or not feeling well, and this overall would lead to a healthier population. And what this entails is that a lot of the sectors within our society would be better. Healthier people means that they can go to work and there's less disability, and all of these sections can be improved if we provide the healthcare that our patients need and that our population needs. And so, just to sum up a little bit, we want to help patients feel safe, reassured, and acknowledged. That way they can feel better and take it upon themselves to live healthier lives. So we're going to talk about how we're going to be out with the old and in with the new. So this change that I'm proposing is really more of a hands-on perspective in the medical field. So this is really what we're going to be forcing upon in our hospitals and even after hospital care. So what this means is we're going to have a change in pain management post-op. So we want to see pain management officials, we want to see physical therapists and chiropractors in our hospitals and after, even when the patients get home, to help make them feel better. So we're going to need more physicians in this area of healthcare. It's not just what drugs can be done, what procedures can be done, but what techniques and what therapies can be offered to our patients so that they can feel better instead of relying on something else and perhaps not even being the solution. So I feel like it's really important to help involve natural care and manual therapies into the system so that we can focus on the patients, because people in this area and professionals in this area really philosophize educating their patients. So this is where it's revolutionary, because patients will then know and understand what to do when they feel pain, how to approach it, why they're feeling the pain, and it gives them a sense of ease, which helps to the road of recovery. And what's important about my proposed change is that this is not only in the hospital, but also after. So it doesn't stop once the patient goes home. A lot of the times, these patients have a long road of recovery during these intensive surgeries, and so they're not able to see a pain management doctor or a chiropractor or a physical therapist within the few months or even years after post-operative care. So it would give a chance for chiropractors, physical therapists, and pain management doctors to go to the homes of these people and care for them. This would also involve more of a teamwork plan rather than, as I previously said, each doctor having their own opinion. So within this change, it would be more physicians in this area that would also help form an entity, a team, to help each patient feel better, to help each patient have a better recovery experience and a better recovery care system. So some of the benefits that can come from this was that patients can feel more cared for. They won't feel neglected. They won't feel as if they're alone. They'll feel as if their staff and the people who are on their team are caring for them. I mean, at the end of the day, it is a healthcare system. We are caring for our patients to make them or help them live healthier lives. We can also have shorter recovery times in general, so there would be shorter times at the hospital and also shorter times when they're at home. So they won't feel as if this is a prolonged journey of feeling better after one surgery, and instead all of these physicians can come and help them. As I said before, recovery won't stop at the hospital. It'll continue once these patients go home. The patients won't feel as if they're dropped and just forgotten. They'll feel as if they have more emotional support. They won't feel as if, okay, well, they left their staff and they're no longer in contact with the staff from the hospital. Instead, the staff is there at home for you too. You won't feel as if you're neglected. And after the family and the friends stop caring to a certain extent about this patient, the chiropractors, physical therapists, and pain management professionals will be there, and they'll offer the support and education and techniques and therapies that they need. So this would also increase the chances to get back to preoperative functionality or better. Some patients feel as if after post-op they're not really getting back their functionality that they had before. And this would kind of help reach that goal, or maybe even have them feel better, because we're implementing new education systems for our patients. And so if they're more educated on how to live healthier lives, hopefully they'll start living healthier lives. And finally, this is a great opportunity to increase jobs and slots for people to use their degrees and be in different environments. A lot of these physicians and professionals in this area of hands-on or therapy, pain management, they're kind of due to stay in their own private sector. They're kind of due to have their own private practice, and sometimes people want more experiences in the hospitals, and this would allow for that. And this would allow for other people to find jobs rather than just, okay, I have to start my own business. Okay, so now we're going to talk about injuries and surgeries and what specific ones would apply to this change. So more specifically, it would be severe injuries and surgeries. It would be ones that are intensive and maybe even invasive. That way, these patients who are, like, after this type of surgery, they would be in immense pain and maybe even a long road of recovery, and we can shorten that. So this might include spinal surgeries, hip and knee surgeries, car accidents, or even sport injuries. This is usually the area where pain management, physical therapy, and chiropractors take part in. However, it does not need to end there. And so other serious surgeries can be involved, such as those that are related to cancer, to reduce cancer symptoms. That's also a long road to recovery for cancer patients. And so it could possibly help them too. Overall, any surgical procedure where recovery is a big concern or a big journey, these type of patients who fall under these surgeries can greatly benefit from this proposed change in our systems. So who is involved and why? So who's going to really be helping and be part of this plan that I think should be implemented into our hospitals? We're starting off with pain management. These doctors would kind of be the team leaders for this group of professionals. They'll help guide the team to see what has to be done next to minimize pain and increase functionality. A lot of patients define their recovery based on their functionality, and so this is what we really have to be focusing on, and pain management doctors would really take head on that and consult with other doctors and tell them, advise them, suggest to them that things need to change. That's where also physical therapists come in, which typically they help patients get their functionality back, or even at a better place. Therefore, to do it at a better pace. We would also expect them to be present more often. I remember when my father was in the hospital, he was bound to a bed for weeks on end, and so walking and getting up wasn't an easy task for him anymore, and physical therapists really came in maybe once a week, if we were lucky, twice a week. Sometimes they wouldn't even show up during that week. So we really want them to be present more often and show their faces to our patients. We also want them to educate our patients, because physical therapists would be showing exercises and therapies that can be done at home or on their own time in order for patients to start feeling better, and they would be checking up on these patients, making sure that they're actually doing the therapies and the exercises that they're told to be doing. Next, we'll have our group of chiropractors, which would be focusing on relieving pain. We would also expect them to be present more often. When my dad was in the hospital, he never spoke to a chiropractor. That was never given as an option, and he had a lot of back pain due to his inability to walk, so he was bound to a bed. His back was in severe pain. He even ended up getting ulcers and sores on his back, and there was no chiropractor to help reduce his suffering. And chiropractors also have a big philosophy on educating their patients, and this would be very important so that these patients feel as if they have everything that they need to feel better, to relieve their pain, so that when their pain does show up, they know what they can do, what to purchase, what equipment is best for that, when to see a chiropractor down the road, and really just help our patients get all the resources and education that they need to feel comfortable in their own skin and after their surgery. So this is a case study and interview that I did to help kind of gain evidence for my project. I spoke to Dr. Corey, who is a chiropractor in Union, New Jersey, which is close to where I'm from. And he said something that really stuck with me, which was change is needed for the patients, and this could make recovery better for them. I hate seeing the pain in the patients when they seek out surgery to feel better, and instead they feel worse. So within his experience, he kind of focused on how patients really sought out surgery first, or were told that they should go to surgery, whereas at the end of the day, it didn't help them. So it really tore his heart as a healthcare professional, because we do want to see our patients feeling better. And then there was also a case study trial that I read up on. It was called a postoperative pain management after radical cystectomy, comparing traditional versus enhanced recovery protocol pathway. And one of the quotes that also stuck with me was that patients on the protocol of enhanced recovery after surgery use significantly less opioid analgesics, possibly contributing to decreased post-operative ileus and shorter length of hospital stay. So yes, this paper did focus on cancer patients and cancer surgeries. But as you can see, this new enhanced recovery protocol where teamwork was implemented and pertaining to focusing on the patient and how they're feeling really helped the patient for the long run. They had a shorter length at the hospital because they were more comfortable on being at home by themselves, and there was less post-operative complications and symptoms. So in conclusion, this change really does need to be applied to our systems, and it has to happen soon. We need more professionals to consult and assess our patients and make them feel comfortable with their process, their journey, so that they can feel better. And if they're feeling better, then they'll, in their own mindset, they'll feel as if they're recovered. So we also need to implement that, or remind ourselves that patients understand their recovery better than the physician. A doctor can't sit there and say, well, you will feel better because you used to do this. No, the patient knows how they felt before and if they're feeling that way again, or if they feel better. And there's also a wide variety of benefits that can come from this change of the post-op recovery system, as I previously mentioned. So just to wrap things up, I want to show why this is really important to me, why this project spoke out to me, and why it mattered. And that's because I am an aspiring chiropractor, and as the picture says, happy patients equals a successful practice. We want our patients to feel happy, to be better, to feel better, live healthier lives, because then we know we're doing our jobs, and our patients can be satisfied. And every practice and every institution and facility that we have that focuses on healthcare shows that it's being successful, and not just showing that the patients are coming back or the patients are having a longer recovery time. Not to mention, this is also close to my heart because my dad was also in a hospital for years due to cancer. And so seeing how the system failed him really showed me that there was need for change. And this is a list of my references, and I really thank you for listening, and I hope you enjoyed my presentation. Thank you.